Biopsychosocial review of diabetes, understanding the causes, treatment, and assessment of diabetes. Diabetes is a chronic metabolic disorder marked by elevated levels of glucose in the blood, resulting from defects in insulin production, insulin action, or both. Insulin, a hormone produced by the pancreas, is crucial for the uptake of glucose by cells for energy production. When insulin production is inadequate or the body cells become resistant to insulin, glucose accumulates in the bloodstream, leading to hyperglycemia and potential long-term complications such as cardiovascular disease, neuropathy, nephropathy, and retinopathy. The prevalence of diabetes has increased steadily over the past few decades, driven by factors such as aging population, urbanization, and lifestyle changes. Understanding diabetes from a biopsychosocial perspective is critical because it encompasses the complex interplay of biological, psychological, and social factors. As we continue to the biopsychosocial model, understanding diabetes through a biopsychosocial lens is important because it recognizes that this condition is influenced by a complex web of interrelated factors. For instance, why biological components like insulin resistance and pancreatic function are central to diabetes, psychological factors such as stress, depression, and health behavior significantly affect disease management and the outcomes. By incorporating these diverse elements, the biopsychosocial model provides an extensive framework for addressing diabetes, facilitating more effective preventive strategies, and a personalized treatment plan and holistic patient care. The biopsychosocial model represents an integrated approach to understanding health illnesses and encompassing the interplay between biological, psychological, and social factors. This model predicts that the health and disease are not solely the result of biological processes such as genetic physiology, but are also influenced by the psychological factors. Now we're going to continue with the biological factors in diabetes. There is a lot of information here, so I will summarize more with going into the effects of the body. The pathophysiology of diabetes involves the complex mechanisms that lead to significant health complications. In type 1, the absence of insulin results in uncontrolled blood glucose levels, whereas in type 2, that typically develops from a combination of insulin resistance and beta cell dysfunction, leading to chronic hypoglycemia. Long-term high blood glucose levels can damage blood vessels, contributing to cardiovascular disease, kidney failure, and visual impairment. Additionally, the body's inability to utilize glucose effectively can lead to peripheral neuropathy, resulting in pain and loss in sensation, particularly in the extremities. And of course, here as above, we're going to continue with the psychological factors in diabetes. Lifestyle choices and habits significantly influence the risk and management of diabetes. Poor dietary habits, such as consuming high-calorie, low-nutrient foods, contribute to obesity and insulin resistance, which are key factors in the development of type 2 diabetes. Physical inactivity further exacerbates this risk, as regular exercise is crucial for maintaining healthy blood glucose levels and enhancing insulin sensitivity. Therefore, behavioral interventions that promote healthier lifestyles and adhere to medical advice are vital for reducing the burden of diabetes. Mental health conditions, particularly depression and anxiety, are prevalent among individuals with diabetes, and they have a biodirectional relationship with the disease. Depression is associated with poor glycemic control, and increased risk factors of diabetes relate to complications, as it can lead to neglect of self-care behaviors. Now, as for anxiety, characterized by excessive worry about blood sugar levels and potential complications, can lead to hypervigilance and overuse of medical resources, further stressing at healthcare system and the individual. Some ways you can deal with this is cognitive behavioral therapy, mindfulness practices. Now for social factors, I continue to state how socioeconomic statuses play a crucial role in the development of management of diabetes. Individuals from lower socioeconomic backgrounds often face significant barriers to access healthcare, which can lead to a delayed diagnosis and poor disease management, which these also factors can go back and lead to stress relating to anxiety and causing depression. As you can see with the graph I have on the right hand side, it shows how a lot of people don't have access to healthcare and are actually diagnosed with diabetes, and they're unaware of it due to lack of resources. Some cultural influences and social support when it comes to diabetes. Cultural beliefs and practices significantly impact dietary habits and health behaviors, which are critical in the context of diabetes. Different cultural groups have uniquely dietary practices that can either mitigate or exacerbate the risk of diabetes. For instance, diets high in carbohydrates and fats and fats common in some cultures, as I can relate because I am Caribbean. So we do eat a lot of starchy foods, which tend to have a lot of carbohydrates. So it is hard practicing a healthier diet. But as we go back to what is in the text, are associated with increased risk of development in type 2 diabetes. In my side of the family, both sides, they do have type 2 diabetes. I have type 1, but it is very common in Caribbean cultures. Furthermore, cultures' attitudes towards health and illness, including the use of traditional medicine and the stigma associated with chronic conditions, can influence how individuals perceive it. As far now as when we go and continue to the etiology of diabetes, type 1 and type 2 diabetes are each with distinct biological etiologies. Type 1 diabetes is primarily caused by an autoimmune response that has resulted in the destruction of insulin-producing beta cells and in the pancreas. The autoimmune attack is often triggered by a combination of genetic predisposition and environmental factors. Now, for type 1 diabetes, these genes are involved in the immune system recognition of self versus non-self and mutations, which can lead to the body erroneously attacking its own pancreatic cell. As far as type 2 diabetes, it is characterized by insulin resistance and is commonly associated with obesity and genetic predisposition to the disease. Insulin resistance occurs when cells in the body become less responsive to insulin, a hormone that regulates blood glucose levels. Overall, while type 1 diabetes is regularly driven by an autoimmune mechanism and genetic susceptibility, type 2 diabetes is primarily associated with insulin resistance due to obesity and complex interplay of genetic factors. Understanding these biological pathways is very important. Here I have inserted a graph that just kind of shows, well, not a graph, but more of like a picture kind of describing the different types of diabetes and some of the symptoms associated with it. And also, as in below, it says high levels of glucose in the blood and tissue and where it can affect the body in certain areas of the body. As I had stated before, how some of the negative consequences can lead to neuropathy, cardiovascular disease, peripheral vascular disease. Now let's understand etiology in the psychological perspective. Stress and emotional factors and behavioral factors. Of course, eating habits, physical inactivity, and adherence to treatment, and stress, such as chronic stress, can exacerbate diabetes by influencing lifestyle choices such as poor diet, as we discussed earlier. Unhealthy eating patterns. Now we continue to go on with the social perspective. Urbanization and all the lifestyle changes. The increase in processed food now that we have in our society today can also be contributing to diabetes, especially type 2. Access to care, lack of health care, and I have inserted another graph for you guys to take a look at to show some statistics about the food, dessert, and the way we have our foods being processed more and more every day that can lead to health issues. Here are some evidence-based treatment on a biological intervention, such as insulin therapy, oral hypoglycemia, dietary changes, exercise, pharmacotherapy, and technology. There are CGM monitors and insulin pumps that offer real-time data, so that way you can keep up to date with your blood glucose levels, as well as giving yourself insulin to make it easier for someone to manage diabetes. I myself have used some of these symptoms, such as using an insulin patch, and also a patch that monitors my glucose levels, making it so much easier for me to understand where my numbers are at and just keeping me up to date with how I'm feeling. Here are some evidence-based treatments, psychological interventions. As stated before, CBT is a structured, goal-oriented therapy focused on modifying dysfunctional thoughts and behaviors. Application in diabetes, self-management, super important, enhances the ability to manage their conditions by changing negative thought patterns and improving coping skills. Stress management, mindfulness-based stress reduction, and also motivational interviewing, a counseling approach that helps patients find internal motivation to make positive behavioral changes. Of course, adjusting your entire life and diet, especially as a young person, it's extremely hard. We get busy with our schedules and we're unable to practice some of these healthy lifestyle changes. So also using some of these techniques is very useful to help somebody with their diabetes and also stress, because stress does elevate the blood glucose levels, as I had stated earlier in the presentation. And of course, adherence to treatment. I always want to encourage patients to continue their medications and diet and exercise. Some social interventions include community programs, policy interventions, and social support. Diabetes education and support groups are very important, and I think are a very good resource to utilize for people, especially when they first get diagnosed with diabetes. Connecting and understanding and getting educated and having people going through similar issues are very, you just as a person will feel supported. So this is also very good for people. And the involvement of family members, of course, is great because people do need that, because emotionally it does tear down somebody when they have to know that they have to deal with this illness for a long term, and achieving better clinical outcomes. Now, as far as assessment instruments for diabetes, instrument overview, description. The Diabetes Self-Management Questionnaire, DSMQ, is a standardized tool designed to evaluate self-management behaviors in individuals with diabetes. It encompasses various domains such as glucose management, dietary control, physical activity, and healthcare use. The DSMQ consists of 16 items, each scored at a 4-point Likert scale, assessing different aspects of diabetes self-care over the previous 8 weeks. Assessment. The DSMQ is utilized by healthcare professionals to measure self-management practices among diabetic patients. It provides a quantitative analysis of patients' ability to manage their conditions, highlighting areas that may need improvement. And clinical applications. Clinicians use the result to tailor educational interventions and support programs aiming to enhance self-care behaviors and optimize treatment outcomes. The impact. The data from the DSMQ offers critical insight into patient self-care habits and their correlation with glycemic control. Advances in diabetes research. Current studies, recent findings, and their implications. So let's start with the recent studies have identified new genetic markers associated with type 2 diabetes, enhancing our understanding of the disease. Hereditary components. This could lead to personalized treatment plans. Immunotherapy. Trials are on immunotherapies for type 1 diabetes show promising results in slowing diabetes progression by preserving beta cell function. Now for lifestyle interventions. A comprehensive meta-analysis demonstrates that lifestyle interventions, including diet and exercise, significantly reduce the risk of developing type 2 diabetes in a high-risk population. These findings suggest a shift towards more personalized and preventative approaches in diabetes care, potentially reducing the incidence and improving management outcomes. And now for future directions, we have stem cell therapy, artificial pancreas system, microbiome disease, and also potential breakthroughs. These all could revolutionize diabetes treatment by shifting from a management to potential prevention or cure, significantly impacting patients' outcomes. Investigating the gut microbiome's role in diabetes, which potential to develop microbiome-targeted therapies to improve insulin sensitivity and reduce inflammation. There's definitely a whole bunch of research that's going in. I've even heard how some people can actually get pancreatic transplants to help people to overcome type 1 diabetes and produce insulin. Now let's talk about the case study. Here we have a case where Mr. Smith is a 55-year-old Hispanic male who is struggling with diabetes and depression, and also has socioeconomic challenges and limited social support. Interventions that were implemented was medication management, cognitive behavioral therapy, stress reduction techniques. Results of these interventions is that Mr. Smith was able to demonstrate significant improvement in his diabetes in the period of 6 months. Barriers to care: economic, psychological, and social obstacles. Some are economic obstacles, psychological barriers, social obstacles, treatment adherence, lifestyle factors. Strategies for improvement would be economic support, mental health integration, and community programs. Implementing policies for affordable medication and expanding healthcare coverage would be a great benefit to improve some of these barriers for care. Some implications for practice is importance of a multidisciplinary approach, such as holistic, improved outcomes, and coordinate care. A team-based approach ensures comprehensive care. Also, patient education, tools and resources, behavioral interventions. All of these are great practice. Now we come to the end of my conclusion. I thank you so much for taking the time to understand the biopsychosocial review of diabetes. And hopefully with this, there are some things that you may be able to learn that you can also integrate.